All right, I just started the recording. Good morning, everyone. Welcome to the May Brooklyn Developmental Disability Council monthly meeting. We have a pretty good agenda today. We have our normal updates from the council from OPWDD. I see Nina. Good morning. We have Joe from IAC to give an update, updates from our committee chairs, and then we also have a presentation, thanks to Rihanna for making the connection, from New York City Department of Health and Mental Hygiene on early intervention services. That presentation is going to be by Dolores Guardinella and Sharon Gooding. Hopefully I pronounced those names right. So we appreciate them for both joining us and taking the time to do a presentation for us here today as well. So I will start. As a reminder, our fair is coming up a month from today. The Brooklyn Family Support Fair back at Brooklyn College from, 9:30 to 2, I believe, or 9 to 2:30.
Correct.
Yeah. You do have to register, even if you're attending for free. Just to get resources, you do have to register. The college does ask for a list of all attendees. So it is free to register for families and professionals. The only fees is if you're looking to table at the event. And all of that information, I'm sure you're sick of seeing me email it all out, but I will continue to do so until we get closer. The good news is we have just about 300 people registered already, and we have 63 agencies registered. So we're getting right about to where the numbers were last year. We had 75 table agencies represented there, and we had well over 300 people attend throughout the day. We will have light refreshments throughout. We will have our photo booth back, thanks to our friend Amanda at Pretty Gal Media. So it'll be a really good day, lots of resources, lots of information. And we're also working on potentially doing 2 breakout sessions. We're still just waiting to confirm those details and that information, and we'll share that out as soon as we have the details. Some other council news. So as of right now, we still plan on holding our June meeting. It is scheduled for June 22nd, so a few days after our event. So right now we are still planning to have that to close out the council year. But before then, after today's meeting, tomorrow, you should also have these links from the emails I send, is the Meaningful Day Committee. And the topic tomorrow, the meeting is at 4:30 on Zoom. The link is on our calendar on our website, and it's summer fun activities in Brooklyn. So there's going to be a number of organizations and agencies that are just talking about free summer activities that are available to the IDD population in Brooklyn. So please attend that. It should be really good and lots of fun activities for you to bring back to loved ones or the agency that you provide services in. On Wednesday, the Brooklyn Family Support Service Advisory Council is having an in-person meeting at the Brooklyn Public Library Flatbush branch. That's also on the calendar with the address and the times. And I'm sure Chris and Debbie will give an update on that in a little bit.
Yes, sir.
And then, am I missing any other upcoming meetings? I think there was a couple of last week that hopefully we'll be able to get a couple of updates on. But yeah, that's what's coming up. So please register for the fair. I'll put the link in later. But it's on our website. It's on the Facebook. It's in the emails that I send out. Anything I missed, Rochelle? Oh. All right. So I will pass it over to Nina from OPW for the OPWDD update. Thank you, Nina.
Hi, good morning, everyone. Is my sound okay? Just to make
Yep,
sure. Okay.
perfect.
Okay, so I'm gonna start with announcing some events that OPWDD is planning in upcoming months. So this year we are partnering with several New York State agencies for this year Get Outdoors and Get Together Day, which promotes accessibility, inclusion, and community participation for people with disabilities. The event will take place on Saturday, June 13, at locations across the state, including several locations in New York City and Long Island. In New York City, the event is scheduled in College of Staten Island and Danny Farrell Riverbank State Park in Manhattan. Activities will include accessible recreation, adaptive sports, equipment demonstrations, assistive technology displays, and inclusive outdoor programming designed for people with or without disabilities. We encourage families, providers, self-advocates to participate and to help spread the word throughout our community. OPWDD staff will also be on site at many locations, supporting activities and our engagement efforts. For New York City, if agencies are planning to travel in larger vehicles and vans or buses, we would suggest that you register in advance to help manage parking and accessibility needs. OPWDD is also planning 2028-2032 strategic planning forums. We again this year launching development of its next 5-year strategic plan that will cover 2028 through 2032nd year. We are placing a major focus on collaboration and stakeholder engagement to help shape the future of our OPWDD system. So over the next 18 months, OPWDD will conduct forums, listening session, we will schedule topical town halls, surveys, self-advocates, speak out, and to gather feedback from people with developmental disabilities, families, agencies, community partners across the state. This year forum will focus on 3 primary areas. That would be the first one, improving customer experience and system navigation. Second one would be improving and strengthening quality and service delivery to people with developmental disability. And the third one is planning for the future through innovation, sustainability, and expanded supports. We are also emphasizing outreach to communities and individuals who historically may not have had a strong representation in planning discussions, and ensuring that a broader range of voices help to shape OPWDD, our future priorities. In New York City, the forum is scheduled in person on Tuesday, June 9. Mark your calendars from 1 to 3 p.m. at 25 Beaver Street in Manhattan. That is our OPWDD office in Manhattan. Additional forums will occur statewide, including Buffalo, Binghamton, Westchester, Albany. Later in the year, virtual forums will be also provided. The interesting shift that we are making this year is that in the past we have moderated Q&A models, and this year we're moving to a more interactive discussions, allowing people who are attending the sessions to ask questions directly related to strategic plan updates and initiatives. We will require advanced registration for planning purposes, right? But you don't need to send your question in advance. And to better manage individual concerns that usually families bring in these forums, we will provide contact forms for feedback to document personal issues or follow-up requests that we will work on and follow up. We will also the forum will also have CCO tables this year again. And as I mentioned, additional virtual topic-specific stakeholder sessions will be planned in the fall, and Commissioner is also looking to have provider-focused virtual roundtables later in the fall, and that would be potentially coordinated through regional provider meetings. So that would be a plan. A new plan that we're starting with. I also would like to give some updates about the Ombudsman program. So the Ombudsman program operates independently through the Community Service Society of New York and helps families and people to better understand the OPWDD system, access services, and address concerns related to quality and rights. So we have implemented or launched this program more than a year ago. And Ombudsman program has not the report. We Community Service Society is preparing to release an annual report, and although it's not published yet, the preliminary information highlights the significant level of support that the program provided in 2025. From the information that was shared with us, the Ombudsman program assisted more than 1,000 individuals through helpline calls, emails, website inquiries, and the most common concerns involved access to services, eligibility questions, quality of care, and overall understanding how OPWDD system works. So we value this feedback, and we take it as an opportunity to improve our customers' experience, communication, and access to services throughout the system. And that would be it for me for today.
Thank you, Nina. I see Debbie has a question for you.
Good morning, Nina. At the event that's on at 25 Beaver, did you invite are the advisory councils been invited to leave our information or have a table so people can contact us? I haven't seen it.
I don't think that OPWDD sent an official invite, right? And I think it's going to be in a similar format that we had last year with the CCO tables.
But you know that we have councils that are required to do outreach.
Right.
And we, this is the second year in a row that we're being not asked. And I'm saying this as polite as possible. We feel that you don't want us.
I think that we can take this conversation offline, but I remember last.
No, I have nothing more to say. It's okay. I'm used to this. I've been doing my thing a long time.
You can send a request to James, and we're gonna elevate that, right? Although the same thing last year, I think I was asking that you elevate, and propose that
I did.
The councils.
I did that. Remember also that we had printed out the QR codes so they can get to, if they couldn't be, whoever wasn't of the council weren't able to be there, we had their way to contact them. So we did assist the other councils. But I'll email James. Thank you.
All right. Rochelle?
Good morning. Sorry, having a mute button issue. Nina, thank you for the report. I have just two comments and a suggestion. One is, I think I would encourage everybody to look at the IDDO annual report. If anything, it really demonstrates that this agency was truly needed. And I think for most of us, there were no surprises in the types of issues that people and families were bringing to the Ombuds program. So, but I feel like they've had a very good record at helping to negotiate resolution for a lot of the issues and providing valuable education. I'm doing a plug. The other thing is, I'm also very happy to hear about the upcoming strategic planning forums. And you might suspect I'm very happy about the change in format, that people can ask more questions directly. I think that that's going to lead to more information that OPW can use. I'm also very pleased about the outreach to some of the communities that have been less represented. I was wondering if you had any information about which particular communities in Brooklyn are getting this kind of specialized outreach, because we have so many. And I think it would be important to make sure that everybody is getting the outreach. I'll give you an example. The Haitian community, for example, I have not in the past seen, much representation from folks from that community at OPW events. The second comment on this is last year, through a sort of offline conversation I had with some of the leadership in the Asian community, I know that they have special meetings for folks in the Chinese speaking community. But I also said to them, I said, it's important for everybody else to hear your issues and for you to hear everybody else's issues, because otherwise everybody gets siloed and segregated. So I would hope that OPWDD, in addition to having these specialized meetings, would also encourage at least some representation from these other organizations and communities to attend the general events so that we can have better understanding of each other, which doesn't often happen. I'm sorry to say, but that's just a proposal. Thank you very much, Nina.
You made a very good point. So thank you for that. And we're going to elevate it. And I think I always say that your voices matter, and the feedback is always, we always share the feedback from the community.
All right. Chris?
Yes, Nina, I actually agree with both ladies, what they say, because as an individual, last time I remember, and I'm speaking as an individual, and even with the Long Island Railroad strike, which is something that I'm surprised I didn't hear any input from you, Nina, or how's the OPWDD staff, how they're doing with this issue. What I'm also seeing is, and I want to thank Rochelle saying something that's very important. She is correct. In all the country, all the representing in Brooklyn, we hope to see this, because there is a message that we as individuals, and forgive me, my Wi-Fi might be acting weird today because I think because of the heat. We just need, Nina, as you're the deputy director, but we still need sometimes, when we send something out to you or anyone, and I want to thank the Brooklyn DDR because they do respond back. But with anything with invites and stuff, a courtesy will be really respectful, not just to the councils, but to families and individuals who are not just the self-advocacy, but me as an individual or anyone, and you got to say, oh, we're going to do the sideline. Every time we do these sidelines and we have to, it doesn't solve anything. It's like, even if I make a mistake, I will admit it and I will apologize in front of a council. But what I just have to hear, it's hurtful. And I'm embarrassed because I've been here for all these years, and we're trying, and like as I do these outreaches and I do the fair so many years, I just think a little more invites and communication, because if I get the invites, I get it from Albany or from James, or there are times I will get it from Angela or Robin or him or the follow Eric Magwood. So please, let's try to work on this, because a lot of people like to know what they're preparing for. And July is Disability Pride Month. I hope you're not putting those events again on July, because Disability Pride Month, it's getting the families out to celebrate and getting what they need to get, and making sure part of it is important today. And I thank the two ladies, Rochelle and Debbie, because they have a good point. Thank you.
Thanks, Chris. Thank you, Nina, for your report.
Thank
If
you.
anyone has any other questions, they can always reach out to Nina, or they can reach out to me and I can get it over to Nina and try to get you guys answers. Nina's always very good at answering and giving support and guidance. So thank you again for being here.
Thank you.
I will now pass it over to Joe from IAC.
Good morning, everybody. Thanks, Brian. So quick update on I'm going to start with a very quick update of the on federal level. We're still in the point where the president's proposed budget has been put in with the proposed and suggested cuts to services and systems that would affect a lot of our folks. So it's still time to be working, to be reaching out to your representatives and having conversations if you can, and bringing your own personal experience to that conversation. But also, I will, after I'm done speaking, put the one-click links through IAC in as well. Those are mostly state focused, but it reflects the kind of advocacy we need. The one thing I want to update from last month is I had reported out that we're still waiting on the response. I believe when we had spoken last, we were still waiting on the response from New York to the letter from CMS. That letter has been sent. It hasn't been distributed, so I don't have it to share with everybody, but I did see it at one point. I do know that it was in response to the initial March letter that came from Dr. Oz to the state of New York, making wild claims, actually, about fraudulent spending in the Medicaid system that subsequently even the federal government has acknowledged the math they did in presenting those numbers was inaccurate and wildly wrong. So that the letter did delay from the 30-day response, because that happened in between the time when the CMS letter came from Dr. Oz and when we were to respond, but they have responded subsequently with all of the evidence proof that those accusations were incorrect. However, just last week, I believe it was May, I'm looking at my notes here now, May 13th, the HHS Inspector General sent letters to states' attorneys general in all states, making sure that they were very clear that the administration's perspective was that the state Medicaid fraud control units were responsible and required to work in conjunction and show their work to show that they're rooting out all levels of fraud at the risk of losing Medicaid funding. They also announced, without much detail, withholding of about $1.3 billion of Medicaid funds from the state of California. I was on an anchor call last week where this was discussed, and the folks in California are struggling to understand what this is going to look like, because they haven't really laid out the details. But it does speak to what's the kind of the environment between the federal and state Medicaid offices. So I just wanted to put that on the table and let you know that that's where we are, state of play. So please reach out to your representatives, federal representatives. Please make sure they know how important full Medicaid funding for continuity of care and continuity of services for the people receiving services through Medicaid is. It would go a long way. That's really broad, larger. Let's talk about New York now. In regard to New York State, we still, in fact, while our last presenter was speaking, I got the email update that they're putting forth another budget extender for another couple days. I mean, this puts us out till I think just Wednesday. Today was the end of the last budget extender. But everybody's up in Albany, and hopefully, we have gotten reports that there's a general agreement, but there's a lot of details to work out. And once those details are worked out, there'll be a lot of bills to discuss and vote on as well. So hopefully we'll get something relatively soon. We're now in the mid to late May that we all expected it would come in. So hopefully that information will be coming soon. In the meantime, we still have advocacy goals that we can be working for. This is the one clicks that I discussed. We are targeting the full 4% targeted inflationary increase that was proposed in the one House bills. This came after we had suggested a rise, and the other provider agencies throughout the state had suggested the governor's proposed 1.7% targeted inflationary increase. We had proposed moving that up a point to 2.7. But now when the one House bills came out from the Assembly and the Senate, they both proposed 4%. So that's what we're on board with. We want the full 4%, but we in our conversations, we are going out of the way to make sure that people understand it can't go below the 2.7%, but we would like to get the full 4% targeted inflationary increase. The other Care Force agenda item is really more housing related. We are working to advance housing solutions for the people who work in our systems, our DSPs, other human services workers. One of the bills that we have written memos of support for is the Employer Assisted Housing Matching Grant. This is from Senator Fahey's office. This would the state would provide a matching grant to any organizations that were providing housing support up to $3,000 on a rolling 12-month basis. This would be for approved costs, such as, let me make sure I get this right because I don't want to give bad information here. Security deposits, emergency rental arrears, down payments, and closing costs for primary residences and the like. We're hopeful that that can get through. That's gone through the Senate committees. As of last week, it was sent to the Senate Finance Committee, which is, they can send it back and say it needs cleaning up, but it is also from there that they can clear it and put it up for a vote. So we're going to continue to push on that. Additionally, we're asking for our care teams to be considered as a specialty group in affordable housing, and we're pushing for that bill as well. And in light of the concerns coming from the federal that we just discussed, we did also, as well as the other provider agencies, provide added support to a bill that was actually issued last year regarding OMIG audits and the state's requirements that they consider the solvency of the organizations in terms of recruitments, the extrapolation practices be open and evident, and that they explain, they give reasonable timeframes for recoupment in those cases when recoupment is required, and look at accidents as accidents and not as attempts at fraud. So that's what we're looking at in terms of our advocacy. I would encourage you all to go to the one-clicks that I will put into the chat after I'm done here. Since we last spoke as well, we went up to, I'm straight reading because this is Kate's area of expertise. So if any questions I can take back to her. But we did go up for our education lobby days up in Albany early this month, maybe about 10 days ago. And there's great turnout. We had a strong presence. About 18 education committee members came, including coalition partners from our partners at Donny in Western New York for meetings with key legislators. Our goal was to show our programs fill an important gap in the education system and have wide reach across New York State, and we need consistent support. We held briefing with influential chairs of education committees, Senator Shelley Mayer and Assemblyman Michael Benedetto, and Assemblymember Tapia. They are hearing our concerns loud and clear. We are pushing for a funding increase for special education providers, which is actually tied to the statute, and pointing out that increases to school districts and teachers for universal childcare must also include increases for special education providers at our 4410s and 853 schools. We are focusing on teacher retention and asking for at least $30 million for our ETTPP program, excessive teacher retention program, and that helps us keep our teachers from leaving for higher paying jobs in the public school system. We did actually run into some conversations through our advocates who are working in the field regarding some labor and hiring barriers. We wanted to end the waiting period. We are supporting legislation to fix a specific New York City issue. Right now, if a teacher leaves the Department of Education, they often have to wait 1 to 2 years before they can work in our special education programs again. We want to remove that barrier, especially when we also want to prevent the Department of Education from forcing our staff to leave our programs with less than 2 weeks notice. Right now, the DOE gives a candidate we're getting reports that they give candidates 24 hours to accept the position and start. So it's really an unfair practice. And when we spoke with I was actually in those rooms when they spoke and presented this to the legislators. They were very responsive and as confused by it as it sounds. And we're looking what they could do to fix that. And the tone of our meetings with the state has improved significantly. They're much more engaged and collaborative than they were earlier in the year. So that's great. The one other thing I wanted to mention was we did have so our most recent, since we last spoke, we had a provider association meeting with the commissioner. And in the course of that conversation, it was presented to the group that there's understanding that there's significant challenges being faced with the current placement system for residential, the CROW list. There's significant delay in terms of the platform they were putting forward for us to start using for placements. And she wanted to find out more information. Everybody, as I think she was a little overwhelmed at the response that that suggestion came with. So she immediately kind of worked on developing a work group that we have already started to. We've identified the 2 people from IAC that would be representing. She has 2 people from each provider association, and Michael Weinberg from AHRC, and I believe Dalian Porter from ADAPT. But both of them have been in meetings with our membership. 2 different meetings we had so that people could attend, which were well attended. Well over 150 people attended, to express their concerns about what the challenges they're facing in the Crow list. In the course of those conversations, it also became clear that across different regions, it was affecting people in different ways. People were problem solving in certain places where they were really running into issues in others. But even over the course of 2 things, it was enough. If it was a bullet pointed list in 10-point font, it could do 2 full pages, single spaced. There was a lot of things, but we did kind of narrow them down to about 6 or 7 areas of concern, and bring together all the issues that were brought forth by our various providers. We haven't found out yet from the commissioner, and I'm sure this will be followed up at the next PA meeting, when we'll have this meeting. But we will be well prepared for that meeting. We'll have all of our information from all of our providers at that time. But I did want to put that on the list and let you know that that's coming as well. So that's about it for me. I don't see any hands up or any questions, but if there's anything anybody has, please let me know.
Thanks, Joe. There was a Rochelle put it in the chat, but her hands up. Go ahead, Rochelle.
Hey, Rochelle.
Yeah, a couple of things, Joe. Thanks for a very informative report. The small question was, I was just wondering if there was an assembly companion to the Fahey bill.
There is. There's a you're saying for the Fahey bill for the housing.
Correct.
Yes, there's a same as bill. So it actually is. They actually do have a same as bill, and that's what went through before Senate Finance Committee.
Oh, okay, that's good.
Yeah,
it isn't always happening, so that's good.
No, it isn't.
And actually, also, I was wondering, since New York City, the mayor has prioritized trying to decrease the amount of money that the DOE is spending for private schools, if that opens up more of an opportunity for trying to eliminate those restrictions and onerous provisions on our non-public schools.
I do believe it did open up because, and I'm saying this really only hearing the high end points of what you're saying and not knowing much of the nitty gritty detail. But I know when Kate's given this update, she has pointed out that that very point, and she's hopeful that this is where it's heading because it does provide leverage. But that's really where we are right now. It's nothing firm.
Okay. One last appeal, which
Sure.
is that I'm very pleased that the providers are meeting with the commissioner and about the problems with the capacity management system.
Yeah.
Which is not managing much of anything and creating a great deal of frustration for everybody. I would just hope that the providers also raise the issues and remain aware of the problem of people getting onto the Crow list in the first place. And the seemingly somewhat arbitrary decisions that are getting made about whether people can even get on the Crow list. And frankly, this ties into what I think a lot of the provider issues are, which is that they're not getting appropriate candidates to fill their vacancies. And a lot of that is because those appropriate candidates can't even get onto the Crow list. So in the first place, given the new provisions in the ADM that are very unclear, and people don't know how to meet the requirements anymore. So if we can talk about it more, but I think this is equally important to the other issues and will have a long-term effect on who can be served in resident.
Well, I think you're going to be happy when we do come out of the process that those issues were at least represented. I can't speak for how it will be received on the other end. that was very much a part of the conversation. In terms of the management of the kind of the opaque nature of the management of the crow list, that we don't have any insight into what's happening, and then what we're learning often is the fact we had people reporting that they were getting referrals in their referral packets from providers from people they'd already accepted and were living with them, like or people who or requesting ones from people who had either passed or even and many issues in regard to having clarity about how they could. There was also issues with people who they had existing relationships with through other services who wanted to work with them. They wanted to work with them. They had a natural placement. They couldn't even determine how to get that person onto the crow list when they had it coming from both sides. So I'm
going to interrupt you because I think it was answered. People don't even know what the crow list is. I think we're talking in
certified residential opportunities, I think, list, and it's the current manner in which the division or the OPWDD was having people fill vacancies, but it's been very inefficient and hasn't been a wonderfully effective tool, at least from the provider side.
Yeah, it is kind of the de facto waiting list, except we're not allowed to call it a waiting list.
That's right. And, for shorthand, you can think of it that way. But unfortunately, it's got a bunch of rules around it as well, tied to emergency status and stuff like that as well. I see Debbie's hands up.
Good. I got it. One, I'm glad you're discussing about that issue too, you and Michelle, because there are members of the advisory councils who I've had to assist or guide them on making sure they eventually get their kids on the appropriate crows list. The other issue we're getting is about having trouble our families getting eligibility for their children.
Yes, this is a significant part of the conversation as well. Yep. That's happening on several fronts, by the way.
True.
I didn't update this part, but we also were at the after education days. I stayed there with Winnie because there was a testimony before the division of a joint committee between disability committee and labor committee about barriers to employment. And even in that front, as well as on the crow conversation, clarifying and simplifying eligibility was a significant part of the conversation. And there is a push on the state side, at least what they're telling providers and telling people is that they want to find ways that they can cut through some tape. Eligibility across systems has been so siloed that it becomes a real challenge. For, if you're trying, I don't have to tell anybody here, but if you're trying to navigate the system, the confusion between one silo set of rules versus the other silo set of required documentation, and it's maddening. So that has been reported through. It was certainly a part of the conversation around the crow list, and as well as that meeting regarding and that wasn't just from us or just the IDD provider agencies. It was all Medicaid, and disability services.
Yeah, I'm aware of that because you see, now I'm also on my local community board. A lot of the members, they tell me issues they're having too when they're trying to help families, and we're trying very hard. The other thing I want to just bring up really fast is, being represented on the advisory council to the statewide, I chair the subcommittee for the ADM reimbursement. And yes, we wanted and we advocated to make it like Long Island, I'll just use quick. Long Island can say get reimbursed for, say, a new bed. We want the same thing over in the other parts of the states. The other thing is that, yes, we know the changes they made are not that easy to do, but I have been working very hard. I don't always call meetings because we got a lot of stuff off the non-allowable list back to the allowable. But I do ask agencies and they say, yeah, they're going to tell me the info. So I'd appreciate if you don't mind, if you gather any information, if you don't mind sharing, because you see the co-chair of the statewide, Gail, oh God, P, well, all right, Gail P, and she and I are trying very hard because we just want to make sure that family support program stays in effect, because we know that there are people that don't understand. They would love to dismantle family support services. So I'm just asking if you can keep us in the loop so we can work together as a team, because this program has helped many families from becoming homeless or
Sure.
like you know how some kids destroy beds or other reasons. So we're just
Yeah.
trying to keep that program together. So I'd appreciate if we could work together because whatever help we can get, it's we help you, you help us.
Yeah, absolutely. And I will tell you, you're singing in harmony with everybody else across the state, because if you're dealing with anybody on a borderline, or you're getting two very different responses depending on what region you're in or who you're talking to. So these are conversations that are definitely a part of what we're
And you know, Joe, since you do know my son, I've been told always in the past, and I have permission to say this, that one, I faked his developmental disability. I don't know how you could do that. But two, when people see children with their faces don't show the so-called disability, we parents have to become like almost like tigers or lions, or really we have, or even a big helicopter. Just not because we don't want our kids to be independent, but we have to protect whatever services they're able to get.
Yeah, and you need to be able to access the sports so they can be independent. That's all. That's what we're all pulling in that same direction, even if sometimes there's confusion. We're all trying to get
Right.
there. So I agree.
So we'll be working
All right.
together. Thank you very much, Joe.
Thank you.
And I see he
All right.
raised
Thank you,
his hand.
Joe.
Uh,
We do,
Brian,
Chris, is it quick?
I have
We
my
do
hand.
have to move on. We have our presenters waiting. Is it a quick question, Chris?
It's only a quick question just to let Joe know. Joe, can you please let Winnie know if she has any questions about accessibility reroutes? Tell her to email me, because
Will do.
someone in your office has been just emailed me and they were trying to reach MTA. It's better that they reach out to me, because right now all staff are on high deck right now. It's better because I'm be giving out the accessible reroutes. It's been working. Thank you.
Great. Will do. Thank
Is
you. Thanks, everybody.
that quick, Brian?
Yes. Thank you so much, Joe, for all the information. And you guys have Joe's contact, or you can reach out to me and I can pass it to him if you have questions
Joe
after
who?
that you think
I'll put
about.
it in with my one clicks as well. Thanks, guys.
Excellent. Thank you. We do have our presenters waiting, but I know Rihanna from New York City DOHMH had a quick update before we get to her colleagues who are going to do a presentation on early intervention for us. Rihanna?
Oh, hi. Good morning. I just want to quickly report that we are currently in the process of reprocuring our programs. We have contracts in the five borough for clinic services, socialization and recreation, as well as vocational service supports. So we have just put out the concept paper, and we're looking for feedback from families, self-advocates, providers. So what I'm going to do, I'm going to put the link to the concept papers in the chat, and we're really looking, forward to hearing from as much as you as possible, so that to help us shape our RFP. And that is my report.
All right. Thank you, Rihanna.
Thank you, Brian.
All right. I also want to thank Rihanna because she connected me with Dolores and Sharon from her office. And we have them both here today, Sharon Gooding and Dolores Guardanella. Hopefully I pronounced that right. I appreciate you guys both being here today to do a presentation for our group on early intervention services. So do you guys need co-host access to screen share or anything?
We do. Good morning, everyone. Thank you, Brian. We do have a PowerPoint presentation, so if you can actually give Sharon, I was going to say the access. I was going to say
I
she's
gave
going
it to both. Yep.
Okay, perfect.
All right. So you guys should be good. Let me know if I can assist in any way, but the floor is yours. Thank you.
Good morning, everyone. Do you see my screen?
We do.
Yes.
Yes.
Thank you.
Okay. So thank you, everyone, for inviting us this morning. My name again is Dolores Giordanella, and I'm the Director of Regional Office Operations for the New York City Early Intervention Program. And I have with me, Sharon.
Good morning, everyone. My name is Sharon. I am the Director of the Brooklyn Regional Office. Can you please just verify that you're seeing the big screen that I'm sharing and not the little one?
We see the screen that says Department of Health, Division of Family and Child Health, with the New York City Early Intervention Program slide.
Okay, thank you. That's the one. Thank you.
So I'm going to get us started here just to go over a few of the objectives. We're just going to review the purpose of the early intervention program and the developmental monitoring unit and how our process works, and of course, covering a few of the resources that we have for you all. Next slide.
Okay, so good morning, everyone. Again, my name is Sharon. I'm from the Brooklyn Regional Office of the Early Intervention Program. So the Early Intervention Program works with families to provide service coordination, evaluation, therapeutic, and educational services to infants and toddlers with developmental disabilities or delays. The program also provides developmental monitoring services to children who are at risk of developing delays. So the Early Intervention Program, give you a brief history, was on the federal level established by Congress in 1986 as part of the Individuals with Disability Education Act, or IDEA, Part 6. I'm sorry, Part C, excuse me. Then in 1993, New York State Department of Health established Early Intervention Program in Article 25 of the Public Health Law. And along with that, in 1993, New York City Department of Health established early intervention, and we service the 5 boroughs of New York. Just some statistics regarding New York City Early Intervention Program. So as I stated before, the New York City Early Intervention Program is administered by the New York City Department of Health. And we have approximately 220 staff in our 6 locations. We have a regional office in the 5 boroughs, and our main headquarters is located in Long Island City. The New York State Department of Health contracts with about 170 provider agencies for service coordination, evaluation, and services to New York City, and with about 7,000 interventionists. And in 2025, New York City serviced nearly 32,000 children that were referred to either the Early Intervention Program, which is AKA also known as EI, or our Developmental Monitoring, our Child Find Unit. With approximately 50,000 of these children that were referred receiving one or more of the early intervention services. That's either service coordination, evaluation, and or the services. Special instruction, physical therapy, occupational therapy. So some general information about the early intervention program. We service children from birth to 3 years old, regardless of race, ethnicity, immigration status. All children are serviced in early intervention. Services are provided at no out-of-pocket cost to families. Families' participation is voluntary and confidential. In New York City, early intervention services provide these services to families that reside in the 5 boroughs of New York. Now, some information, according to the 0 to 3, 1 in 3 infants and toddlers who receive early intervention services did not need special education services later in preschool. So, and this is an article that is out in JAMA about this, and some research that was done over a course of years to identify and to clarify that children who receive early intervention services, when they leave early intervention or transition out of early intervention, there is low need for them to receive special education services later on. And our brochures and our motto is Early Help Matters.
So who can make a referral to the early intervention program? So basically anyone can, as long as we have parents' consent and they do not object to that referral. So the child's doctor, the parents, child care providers, a social worker, or an early intervention agency can make the referral to the early intervention program. Next slide. So one of the things that New York City did, I was going to say coming closer to the 21st century, was that in October of 2025, we launched our New York City Early Intervention Referral Portal. This is an online mechanism in which any community member, parent, I was going to say even a doctor can make a referral to the early intervention program. What you see here is basically the first screenshot. I was going to say if you log into our portal, and the link to our portal is also on our website, you can on the top there, you see to the left, I was going to say there's a select language. There's a drop down of the top 13 languages so that, if a family speaks another language other than English, they can, have all of this information translated in their language. And on the right side, you see the steps, and it walks you through the steps to make a referral. And this portal allows a family either to make a referral for the early intervention program or to our developmental monitoring unit. And this can be done from any computer, smartphone, or other mobile device. And it does take about 10 minutes for the referral to be completed. Next slide. So I was going to say, again, just showing you a different page, I was going to say, of the referral portal. Obviously before you begin, we want to give, anybody making the referral, what will be required. And we do need the child's full name, date of birth, race, ethnicity, sex at birth. We need the child's address, of course, zip code, and their language or the family's language, I was going to say, and the reason for referral and parents' information. So we gather all this information because we want to be able to move the referral forward effectively and efficiently. Next slide. So if the child, I was going to say, is known to ACS or in the foster care system, we still have our ACS hotline and intake process. So that process has not changed since we launched, I was going to say, the referral portal. So I was going to say, if a caseworker, would like to make a referral to early intervention, I was going to say they would use our existing hotline. I was going to say, and they would call the referral in to our, developmental monitoring staff, and they would then take that referral. And then obviously, with them gathering the information, they would then, I was going to say, help to confirm whether the referral should stay within the developmental monitoring unit, because there is this is a child who's at risk. And so that, developmental monitoring at that point will take over and provide surveillance. Or if the child should be then referred to the early intervention program because the child is suspected of having a developmental delay or a diagnosed condition, and then that referral is sent over to the respective regional office. Next slide. So again, just a brief note here is that developmental monitoring tracks children who are at risk, but who might not currently show delays that would make them eligible for early intervention services. So here you just have a couple of at-risk criteria in the no initial newborn hearing screening or lead exposure, parental substance abuse, homelessness, prenatal care. So here again, just some examples of those at-risk criteria. Next slide. So here, what you'll see here, I was going to say, is how the developmental monitoring unit, the DM specialist, really works with the family. So once the referral is made, then it, of course, and it's staying within the developmental monitoring unit, which is, as Sharon mentioned, our child find portion of the program. I was going to say, then that DM specialist obviously will outreach to the parent. And then I was going to say that parents obviously will share information, and we administer, I was going to say, the ASQ, which is the Ages and Stages questionnaire. And, depending, of course, I was going to say the child's age, the appropriate, ASQ would be sent out to the family. If the family is not comfortable doing this on their own, the developmental specialist will, I was going to say, complete it or help the parent complete it. And I was going to say then it is scored. I was going to say, and then obviously I was going to say once it's scored, I was going to say those results are shared with the family. And I was going to say, there is an atypical scoring, right, that again is shared with the family. And then I was going to say, we talk to the family about a potential referral to the program side for a full multidisciplinary evaluation. Or if everything is going as it should, right, then the child can continue to stay within developmental monitoring. So here what you see is just this loop kind of, demonstrating how the developmental specialist, I was going to say, works with the family and just continuously has this loop to make sure that, the family's questions or concerns are addressed. Okay. Next slide. So just quickly to go over our steps, right? The referral is our first step. The family can call in the referral. I was going to say the child's doctor, but once the referral is made to us, I was going to say then it is processed and an initial service coordinator is assigned to work with that family. Once the initial service coordinator is assigned, right, then the initial service coordinator has the responsibility of informing the family of all of their rights and the steps and helping them get through that process. And also to, I was going to say, refer them and help them get connected to an agency, an early intervention agency that will do the multidisciplinary evaluation. And I was going to say that evaluation then determines eligibility for our program. And then if the child is found eligible for the program, then we move forward, I was going to say, in scheduling the Individualized Family Service Plan meeting, otherwise known as the IFSP meeting. And at that meeting, I was going to say, is where I was going to say the early intervention official designee helps the family develop that plan of service. And I was going to say, we also do then talk about transition, especially if the child is 2 years old or older, because our program, as Sharon mentioned, just covers up to 3 years or the day before the child's third birthday. So we definitely also start talking to the family about transitioning. And I was going to say what their available options are, if the child is already 2+ years when they're coming to us. Next slide. So, okay. So I was going to say early intervention, I was going to say the centralized referral unit will assign, like I mentioned, an initial service coordinator. This is the person who will explain the process to the family, meet with the family, help them, I was going to say, choose that evaluation agency, and help the family plan those next steps. Again, they're supposed to work with the family to ensure that all of this is being done in a timely manner. So the evaluations, like I mentioned before, determine eligibility for the program. It's very important that if we're, helping a bilingual family, that those evaluations are done in the family's dominant language. And I was going to say, and also making sure that the main area of concern is addressed. So the multidisciplinary evaluation includes an assessment of the child's levels of functioning. We cover physical, which includes hearing and vision, cognition, communication, social, emotional, and adaptive. And there's also an evaluation of the transportation needs. And of course, we do, I was going to say, inform everyone that the multidisciplinary evaluation needs to be comprehensive. It needs to include multiple sources of information. It is not a sole source of information that helps determine eligibility. So we could have a child care provider or, information from the child's doctor, I was going to say, that, is incorporated into the multidisciplinary evaluation, of course, with parental consent. Next slide. Okay. So eligible versus not eligible. Again, we have the referral, the initial service coordinator is assigned, the evaluation determines the eligibility. So if the child is then found eligible, I was going to say, at that point, obviously the service coordinator would then work with, let me go, not eligible, then I'll go back to eligible. So if the child is found not eligible, we talk to the family about a referral to developmental monitoring. So if the family consents, with their consent, we can refer to developmental monitoring, where they can monitor the child in case there are other concerns or delays that arise in the future. If the child is found eligible, then we proceed forward with the individualized family service plan meeting, and the service coordinator would work with, I was going to say, the regional office to schedule that meeting and get that meeting on the calendar.
So once a child is found eligible for early intervention and the service coordinator works with the regional office, one in every borough, we schedule the individualized family service plan meeting. And this meeting must be held within 45 days from the referral. At this meeting, the parents' concerns, priorities, and resources are reviewed to help us develop the plan as a whole and to also establish functional outcomes for the family. The following individuals must attend the IFSP meeting, the Individualized Family Service Plan meeting, the parents, of course, the initial service coordinator, the early intervention official designee, that is the EIOD, we have EIODs located in every borough, a representative from the evaluation team that conducted that evaluation, and any other people that the family would like to attend the meeting. Sorry. So this is an example of the form that gets filled out with the family, with the service coordinator, and provided to early intervention to give us information about the family's concerns, priorities, and resources. So the family, like I said, the form is completed with the initial service coordinator and with the family. It's reviewed by our EIODs, and this form helps us to create those functional outcomes at the IFSP meeting. The discussion at the IFSP meeting. So is a review of the information that's gathered about the family, about the child, and like I said, discuss the resources, concerns, and other needs that the family may have. And to also let the family know that they play a critical role in the development of this plan, the services, and with the child receiving services as a whole. Explain who provides services, where and when and how, and to appoint an ongoing service coordinator. An ongoing service coordinator is chosen by the family. And early intervention services that gets provided and can get authorized at the IFSP meeting: special instruction, PT, occupational therapy, speech, social work. We have assistive technology, respite, family training, the service coordination, and if another evaluation is needed, and counseling. These services are provided by qualified personnel, licensed and certified early childhood special educators, birth to grade 2, physical therapists, occupational therapists, speech language pathologists, nutritionist, social worker, and the plan is individualized based on the family's needs. And what the team is a collaborative effort at that IFSP meeting and what's discussed and the plan that's developed. Like I said earlier, we provide services to children birth to 3 years old. And once a child is approaching their 3rd birthday, transition plan with the service coordinator and the family is developed. All children aging out of early intervention receives a transition plan. So around the age of 2, going on 2.6, we start to discuss the next stages. Children age out of early intervention the day before their 3rd birthday, unless the family has gone through the process to go into the next program, the 3 to 5 program, the Committee on Preschool Special Education. If the child goes through the process with the Committee on Preschool Special Education and they're found eligible for that program, the families have a choice to stay a little longer in early intervention, either till August 31st or December 31st, depending on where the child's birth date falls. So the service coordinator is the one to assist the family and help the family with this whole transition process, giving families resources, letting them know their options, helping them through the next stage into the next program if the child is eligible, and helping them transition out of early intervention. And like I said, we have offices in every borough. These are the numbers for all of our offices. We are located in the Bronx, Brooklyn, Manhattan, Queens, and Staten Island. And our main headquarters is located in Gotham, Long Island City, Queens. So we have resources for parents, our community partners, doctors, city agencies, and other early intervention providers. We have the New York City Public Health Action Kit, which includes a kit for clinicians, childcare providers. There's 6 early intervention videos with former EI parents that we share. There's family-friendly educational materials about developmental monitoring, and all of these materials are provided in the 13 most common languages that's spoken in New York City: Spanish, English, Chinese, Haitian Creole, Russian, French for a few. And this is the website where you can find all of our action kits and our toolkits for providers and clinicians. It's on the New York City's government website, Early Intervention Program. And that is the end of our presentations. If anyone has any questions, we will take your questions.
Thank you so much. That was so informative, and we appreciate you guys taking the time to be here today. One question I have, will you be able to share the slides with me so I can share it out to the group for anyone that might have not have been able to attend?
Sure, we can share those slides with you.
Excellent. Thank you. I do see a couple of hands up. Carrie?
Hi. Oops, there I am. Thank you so much for that presentation, Dolores and Sharon. It was really great. I haven't reviewed this in a very long time. But I have a question. I know you said translation was provided, but I'm wondering how you share the results of the testing with families who don't speak English, and also if they are provided with an IFSP in the language that they are most comfortable.
So the first part, I think, of the question that you're asking relates to, I think, our developmental monitoring unit when they're doing the ASQ. Are you asking about how the developmental specialist shares the results if the family is non-dominant in English? So
No, I'm asking how the results of the testing are shared, whether or not they're found eligible.
Okay. Well, I'll answer the first question, even though I'm sorry you were not asking that. So our developmental monitoring specialists use and have access to the language line. So if they're working with a family and their first language, I was going to say, is not English, I was going to say they would use the language line to help communicate with the family and explain the entire process. In terms of the evaluation process, I was going to say, once the service coordinator obviously meets with the family and helps the family, I was going to say, make a decision as to which evaluation site will move forward with completing the multidisciplinary evaluation. It's the responsibility of it's the responsibility of the evaluation agency to ensure that they have the right team that is going to be able to assess the child, especially in the language that the family, I was going to say, is fluent in. So, for example, if it's a Spanish-speaking family, I was going to say it's the evaluation site's responsibility to ensure that the team that they're sending in is able to communicate with the family.
Thank you very much for that, Dolores. I guess I have a follow-up question, and that is, how do they get the written information? So a lot of times families not a lot of times, but a few times a year, families come to the library with the child's IFSP in English, and they have no idea what it means. Or they come with a summary of the tests that were administered and the results of the tests, again, in English. So I'm just curious, it's that last phase, right? The sharing the information about the testing and the IFSP with the families that I sometimes see issues with. So I'm wondering how that's supposed to be dealt with.
So I was going to say, once the evaluation is completed, then the responsibility of translating that information, again, lies with the evaluation agency. They're supposed to provide the family a copy of the what we call the multidisciplinary evaluation summary. That summary should be translated in the family's dominant language, unless the family, for some reason, should opt out to that. But otherwise, I was going to say the summary should be translated in the family's dominant language. In regards to the IFSP, the Individualized Family Service Plan document, that document is written in English. I was going to say that, we follow the format. I was going to say that, I was going to say in all of our documents in early intervention are actually written in English.
Right.
I was going to say, and saved in English. I was going to say, we do have family rights, for example. We do have certain information in other languages that we will share with family. For example, their family rights we have, I was going to say, in other languages, and we can share that. We do also use in the IFSP meeting, if we have a certified individual that speaks that language, that person then will be the person who is, I was going to say, interpreting at the meeting. Otherwise, we're also using the language line to help interpret at the meeting. I was going to say, to ensure that the families understand us. But you are correct that the family is walking out of the meeting with an English written document. That's the way the program is set up.
So how can we fix that? I mean, it's useless to families, to many families. How do we, I mean, here, when people bring that to me, of course, I try and connect them with interpreters who can work on that with them. But I mean, it really is everything from the classification. Well, classification is simple, but they have no idea what the services are to be provided, or how often, or even they can't even read the form. They can't double check the information on it to make sure they have the right birthday or things like that. So how do we fix this?
Well, I was going to say, I think we're making efforts to, I was going to say, ensure that when we're sending family information, that number one, that we're trying to give them as many parts of that information in their language as possible. I was going to say, it's definitely something I can take back and share with, folks on my end to see how, we can go about, I was going to say, shifting practice. But as of now, I was going to say all of our documents are written in English. And that is why we do, I was going to say, not only rely on the service coordinator, but obviously the early intervention official designee who's present at that meeting, right? We're taking time to explain everything to families in their language.
Sure.
And so hopefully they're walking out of the meeting with the understanding of what is authorized, what the plan says, when services are going to start. Hopefully families are walking out of that meeting understanding all of those things. And if they ever have follow-up questions, or they were not sure, or they feel something was maybe not clarified correctly, they can always come back to their service coordinator. And then again, if they still feel like some part of the information was not, given to them accurately, or they don't understand it, or they just want to review it again, then they're always welcome to follow up with us at the regional office, and we will review it. And again, if we don't speak that family's language, we will, obviously access the language line, and we will use the language line to help communicate with families, so we can make sure that the family understood us and they understand what's written in the document if they should have follow-up questions.
I think that's great, all the support that you're providing, but I think it's not the same as walking away from a very stressful and potentially traumatic meeting with something in writing that they can understand. And we all know that people don't absorb information well in those situations. So having that written stuff would be great. I would appreciate it if you could share that up. Thank you very much.
You're welcome.
All right. Next hand up is Debbie.
Hi, I'm going to say this as I'm a retired parent member chair of the advisory. Whenever I hear professionals say, well, when we finish with the program, the child will not have to go to preschool, that's not correct or right. And I will tell you why. A lot of parents, especially if the English is not their first language, do not want to acknowledge that their child may have a disability. They don't want to do that at all. Then, when the child is having trouble, not just preschool, or going into kindergarten, first grade, second grade, the amount of times I had to sit there because the child was reacting, could not handle being in that position. So I think you're doing a major disservice by saying that, because more children who are not getting, it's not just, you're only giving them up to 3 years if they started right after birth. But you don't always get children right after birth. It is not easy. You still have doctors, pediatricians who are totally against telling parents that maybe the kid needs help. So it is very frustrating for me to hear that. Also, not having the translated in writing is a major disservice. In the New York City Department of Ed, a parent can take them to a impartial hearing for not having it in their written language, because the parents at that time don't want to know if their child has a disability. I have a child, we couldn't go through early intervention, and I fought very hard so parents never had to go through family court where it used to be. So I'd appreciate if you explain more that if the child gets a full 3 years of early intervention, they may have a chance where they may not have to go into preschool. And that would be a lot more safer and healthier for the families and also us advocates who are trying to make sure the child is getting the true help they need. Because from birth to 8, they make the most changes.
Well, I was going to say, I think we agree with you. I was going to say, we're not disagreeing. We have a, to your first point, we do have an outreach team. I was going to say, and we're out in the communities trying to, I was going to say, raise awareness that early intervention is out there, because we do want to, let's say, attract the families and children to us earlier rather than later. Because if there is a need, if there is an area that we can help with, I was going to say, and the child obviously is eligible for services, we would want to provide those services as early as possible. I was going to say, that, of course, is the goal in terms of, I definitely hear the concerns that are being raised about families not having the written information in their language. I was going to say, I definitely hear that concern. I was going to say, and I will take that back so we can think about, how to address this. And I think if, I was going to say, I think most of you, know of early intervention, and you know that we are also, I was going to say, taking our directives from the New York State Department of Health, and we work within a system. So, change does take time, but it starts in small increments. And this is definitely something that we will take back to I was going to say, raise awareness that families do need to have information. And I think at the end of the day, that's what I'm hearing. Families need to have the right information so they can access the help that they need for their children. And I was going to say, ultimately, the goal, I was going to say, is to help reduce the long term, I was going to say, if possible. So you're right, not all of our children who start in early intervention, I was going to say, will eventually, I was going to say, need to transition and, let's say, for example, receive services from the Committee on Preschool Special Education. But we are obligated to inform families of what all of their options are as we're, obviously getting closer to transitioning a child out of early intervention. Because you're right, we only work with families for a very short period of time before they leave our system and then potentially go into another system.
And
So
I did parent membering from when they came into preschool. I've helped, I was also on teams when children had to be placed residentially or coming out of prison. So I did the whole thing from when the child starts till they leave. So I've seen it, and I'm also a sibling and a parent.
Thank you.
Thank you, Debbie. There's a couple more hands I see up if you guys still have some time.
Sure.
Sandy, you had your hand up?
Yes, I did. I have one question. I saw in the list of services provided that ABA was not included. How does a child get ABA through early intervention?
Well, I was going to say the ABA, or the Applied Behavioral Analysis. I was going to say if a child, again, is evaluated and found eligible for the program, then we would have an individualized family service plan meeting. And at that meeting with, I was going to say, the early intervention official, the family, the evaluation site representative, the service coordinator, right, we will develop that plan of service. And if I was going to say the evaluators, also make recommendations, we discuss the families, I was going to say, concerns, priorities, and resources. Like Sharon mentioned, we hear from the multidisciplinary evaluation representative, and we're developing that plan. And if the right thing, I was going to say, right, if the service that needs to be provided, because it's the right service to provide, is ABA, then we would authorize that at the IFSP meeting.
Thank you.
You're welcome.
Thank you. Lucina.
Hi, good morning, everyone. Thank you for that information. It's so important to learn about early intervention and having accessibility to the services. I need to ask if you need to request, because we do a annual walk in Canarsie Park in June about parents supporting parents. If you need to request like a tabling from your organization, because we're in Canarsie and we have such a high rate of parents not knowing where to get services for the intervention. How long does it take to make a request for you to do tabling?
I was going to say the tabling events are handled through our outreach unit, but if you send me an email, I can definitely connect, I can follow up or connect you with our director of outreach, which is Miss Shirla McLean.
Oh, I know Shirla.
Yeah,
Okay,
she's our
perfect.
director.
So can you put the information in the chat if you don't mind, please, so I can get it?
Sure, I could put my email address. I was
Yes,
say,
thank you.
No problem. That's fine.
Thank you so much for the presentation.
You're welcome.
All right, I don't see any more hands. So again, thank you, Dolores. Thank you, Sharon. This was a great presentation. I know it's a topic that a lot of people are always confused about and looking for more information on. So it'll be great that now we have this. We can share it on our website. Oh, we have one more hand before you guys go, if that's okay. Ellen has her hand back up.
She never dropped it. I don't know what happened. Here's the question. Well, here's the pile on. I happen to agree with Carrie that if you don't know what's in the report, you really can't actively participate and be informed. But the question is, do you provide sign language interpreters?
Yes, if a family is deaf or hard of hearing, I was going to say we do have a process that the service coordinator can request. I was going to say an ASL interpreter for the meeting and also for evaluations.
Is there a timeline? 3 days notification, 6 weeks?
I was going to say if it's an evaluation, I was going to say the service coordinator.
I'm going to say one more time.
Oh, I'm sorry. Yes, I think there's usually a 3-day turnaround time because we do need to communicate with our Office of Communications because our interpretation services come through the Office of Communications. So we do have at least like a 3-day turnaround that we would need ahead of time to confirm that the interpreter would be available for that either evaluation or I was going to say IFSP meeting, the Individualized Family Service Plan meeting.
So 3 days to get back to the parent with the date when the interpreter is available, or 3 days to say, yes, the interpreter is available on this date?
Usually what we do internally is that we schedule the meeting and we make sure that that date and time is good for the family. And if that date and time is good for the family, then we make the request. So this way, when we get the confirmation from our communications team, everything is already set up. Yeah,
Thank you.
you're welcome.
All right. Thank you guys so much again. I appreciate it. I appreciate you staying on and answering all the questions. I know you answered about the tabling. So the only question I had, if you guys would be interested in tabling at our Big Family Support Fair next month, but I don't know if that's going to be enough time, but I'll reach out
Sure. I'll
to
put
that
my
person you
email
had
address
mentioned. Yeah.
so you can
Brian.
email me and then I can follow up on my end.
Excuse me, Brian, just to let you guys know for the record, I did send them an invite. They have not responded, just for the record. They do attend every year.
Okay. I'll reach out and see if they're available.
Thank you, Brian. I think
All right. Thank you again, Dolores. Thank you, Sharon. This was great. We appreciate you being here and providing all this great information and again, answering all the questions at the end.
You're very welcome. I'm putting my email address in the chat.
Excellent. Thank you.
Thank you.
All right. So now we will circle back. Debbie and Chris, do you have updates from the MTA and the Brooklyn Family Advisory?
And also the provider information. Which do you want me to give first?
You can try to knock them all out at the same time if you want.
All right, here we go. We'll start with the provider information. This meeting happened this past Wednesday, May 13th. This will be the last meeting just for this season, and we'll start back in October. We had Maria Ortiz Casada's team came to present about Medicaid. They also showed us how to use the app and what to do if you have issues. And it was a very, very informative. And yes, they said they will be coming to the fair. So they answered a lot of people's questions about where to file for Medicaid and if you're having issues or trouble, what to do. So that was a big help. The advisory council is having our in-person meeting this coming, not tomorrow, Wednesday, because libraries on Tuesday in Brooklyn are closed in the morning when we have our meeting. So it's going to be at the Flatbush branch, which is on this Wednesday, the 20th, from 10:30 to 1:30, I believe. It's also going to having a mini resource fair, and we're not doing this meeting virtually, so I hope everybody shows up. It's on Linden Boulevard, right near Flatbush Avenue, and that's between that and also Bedford Avenue. So we're hoping everybody comes. The other thing I just want to bring up is this is from the statewide Family Support Council. We are in the month of June. We're being pushed back not to have open meetings. I appreciate no one shoot me. I'm just the messenger delivering this. Many of our families are not happy because they like participating or watching it in person. We are taking down all their notes and we'll make sure that everybody, and I'll get back to everybody in the month of June, but right now we have no idea how this is going to be done, but there is no public meeting for the statewide family support, which is supposed to be, I believe, Wednesday, June 10th or Thursday, June 11th. So that's that. Christopher, you want to go over quick with the MTA? So I'm done.
Yes, I'm going to keep my camera off because I'm getting briefed at the same time. So forgive me, guys. That's why my camera is off. As you are aware, first things first. As you are aware, yesterday MTA, DOT had a special event, which I was there, but that's good news. Now, right now, as the Long Island Railroad is on strike, which we are not very pleased with the train drivers because they're the only ones that are not in the tail law. The other four are, and they are being fined because they're not supposed to go on strike. They could not even supposed to go around the thing. They're around, blocking any access. Right now, we're reminding everyone, if you're in the Long Island area, there are the free shuttle buses, and I like to report that 90% of seniors and disabilities who do work did make it in. And they actually saying this was actually a fun shuttle, which I'm looking at the news media. So right now we are reminding everyone until we might have an update in the next few minutes that the strike might be over. I don't want to say it's a yes or no. I am saying to be determined. If it is, Long Island Railroad will resume normal service tomorrow at 5 a.m. because we have to make sure all trains and signals, including the crosswalks, are secured and working properly. So stay tuned for that. We are reminding, and I have sent this to Brian, and I want to thank Brian for one reason, and Rochelle sending it out. Thank you guys from the DD Council sharing this information out to everyone for the people of seniors and disabilities. We also, just to remind everyone, the Access-a-Ride will be experiencing delays due to the heavy volume on the highways and local streets. It is very heavy in Queens, and it's getting a little heavy in Brooklyn. And I don't have to mention Manhattan, but all I can say is if you're driving in Manhattan, thank you for your $9 donation, because now we can add more accessible stations. And maybe we can build one for other areas too. But it is a very serious right now. We are encouraging you guys to please have courtesy and reminding everyone, all subways are running at 1,000,000%. Right now, we are running extra trains. That means if you see a train, all of a sudden that's not in the clock, means he's an extra train, means it's a starting train. It could be a letter or a number, but it's still an extra train. So please be careful when traveling. Also, just to remind everyone, MTA has reminded everyone, if you have not signed up your Omni cards to make sure it's registered, please do so. And this is for everyone from the DD, this is for all agencies. Please make sure that your families, including your group homes, if they're using the trains or Access-a-Ride, please make sure their Omni cards are registered in the system. Therefore, making sure that you don't have to go to a train station to put money in. You can do it on the computer or a retail store. And well, so far I have seen a lot of people still going to the machines with the day have programs or group homes. Please show them optional. If you want the MTA to come to your agency, let me know, please, so I can email to MTA Accessibility or MTA Government Relations so they can come out. We have gone over everywhere in the boroughs, and yes, Westchester and Nassau County, but unfortunately, Nassau County is a harder issue right now. We are working on that. Brian, there's a hand raised. I think that's Ellie, the famous Ellie McHugh. May you have a question for me? So before I continue.
My question was for Debbie.
Oh, because I'm doing.
Sorry.
Oh.
Debbie, did they give you any reason why they refused to do public meetings?
I think she's responding to her phone call, but I can, the issue.
Oh, I'll answer.
Oh, there she is.
Okay, excuse me.
And then I'll finish after.
Ellen, they said all along, we know, as long as I've been on when Kermit was with us, Kermit Augustine, we're a subcommittee at DDAC. Then we think it was under Governor Cuomo, they had us then go to the open sunshine. That's all I know. I'm not completely sure. I won't know until the actual day of the meeting. So if I hear anything, I'll let you know, because I will tell you the two co-chairs, Kathy and Gail, were meeting because there are two co-chairs were just told they didn't ask them what they thought. They just said this is how it's going to be, and that's it.
Who said it?
She spoke to central office.
Who in central office?
They didn't tell us. You know what? I will tell you also, a lot of families and people went to the DDAC meeting and they didn't let a lot of them speak. I'm going to say OPWDD has a website, they have an email website where you can complain and ask them why.
Complaining without any fact is not going to do anybody.
Well, it's just we would like to know why is the statewide Family Support Committee meeting now not going to be meeting where an open meeting?
And I want to know who said it.
Someone in Central. Right now, we don't have
Central is an amorphous situation.
Right now, you know what? I'm not going to. You know what? We're all asking them questions, Ellen, and until that meeting shows up and we question them, and then get back to it. A lot of members are very upset. I'm not totally happy with that, but the only part I do like is just that I do get more answers from OPWDD when cameras are not on us. I didn't say I agree with this, what they're saying, how they're doing this, but there's not much I can do right now.
That's not
I'm
very
waiting.
comforting. All it does is add to the secrecy.
Well, remember before when we'd go up and I would come down with the report and give it to everybody. So until then, I have no idea yet. There's not much I can really do. I'm one member and they didn't ask our two co-chairs, they told them. So it could be, I'm not even sure, so I'm not going to say whose names. All I can tell you is that Alexis Huntington, she's no longer working with OPWD, and this has been for at least 4 months. So I can't say anything about Alexis. And you can always ask the commissioner. Maybe she'll know. Because it was put out by Central, which is 44 Holland Avenue. Once we hear why, we'll get back to everybody. All right? I wish I could give you more. Can't. Sorry.
All right, thank you, Debbie. Chris, you want to finish up your report really quick?
Yeah, because I understand that the advisory questions are very important, but right now, as I'm glad some people are giving me a little time. Just to let everyone know, as I was getting back to the Omni also, please make sure you guys register that. And I know there was a question in the chat. I'm gonna say we should be hearing an announcement in the next 20 minutes, but if there's a possibility a deal might be resolved. So right now, I should have an answer in the next 20 minutes, and I will email to Brian, and Brian will forward out to all of you. But please, at this time, please experience delays on all buses in the Brooklyn, Queens, and Manhattan buses. Also, some of you who do drive your cars or use Accessoride, because someone was asking me this question, Brian, please, and it's on my end, please allow yourself additional time, because right now with cars driving, it's causing delays on the Accessoride, and we are reminding this to everyone. So Ellie for HRC, because somebody asked me this question, Ellie, please make sure that Accessoride is aware of this issue. They are trying to, but if cars are going to be in the way, it will cause delays. If you have any questions, I'm here, but also you can always email me, and I've been in touch with the rest of them, with OPWDD, letting them know what's going on, and they are aware of it too. So, Brian, do you have any questions for me?
No, I don't. Thank you.
Okay, since no one else has any questions, thank you, everyone. And again, not an easy weekend. So let's pray we get it resolved and get Memorial Day service back.
All right. Before we move to open up the floor for announcements from agencies and anyone else that has anything going on, Angela Blades was here earlier. I think she had to jump off. She asked me to just share, if you need any updates to the family support guide, you need to email her the updates by this Friday so she can get them into the next year's guidebook. Because, she helps OPW put together the family support guidebook every year for family support services throughout Brooklyn and all the boroughs. So if you are listed in the book and have updates for this year, please email Angela Blades by Friday. All right. So now we can open it up for agency announcements. Just raise your hands and I will call on you as I see you pop up. First one I saw is Carrie.
Hi again, all. I put a bunch of things in chat. But I want to just highlight two of them. One is the one-to-one individualized assistance that we offer with Include NYC. It can be invaluable in navigating a system like early intervention wherever you are in the process. So that is usually the first Wednesday of every month. And as I said, I put it in chat earlier. Then also we have a different kind of an event. We're doing a fair on Grand Army Plaza with Vibrant Health and CCSI, the Coordinated Children's Services Initiative. We have a mental health fair on Friday, May 29th from 12 to 4. The weather will, of course, be beautiful. And if it is not, we will be inside in the grand lobby. So we hope to see you there. It is, of course, free. Rumor has it that there will be some food. I can't vouch for that. And health screenings and lots of swag. So please join us and find out more about mental health resources for everyone in Brooklyn in particular. And finally, and this is the newest thing, we are hosting a group called Unmasking, and it's a neurodivergent support group for adults. I think they're really focusing on autistic folks, and it's a new thing for us. We've had a lot of requests for this, and a parent member from a school is going to be running it. Again, it's neurodivergence in general, but their focus is on folks who are autistic and folks with ADHD. So again, the information is in the chat, and you can always call me for more details about either one of those, any of those. Thank you very much.
Thank you, Carrie. Doris?
Good morning, everyone. That was a great presentation on our early intervention services. Thank you. My name is Doris Khan. I am the outreach coordinator for New York State Institute on Disability. We're a family support agency, and summer is here, literally, with the temperatures in the 80s today. So I want to tell everyone that NYSID reimburses for camp. Now's the time to think of camp and reimbursement. The camp has to be located in New York State. It has to have a current New York State Department of Health certificate, and it cannot get waiver respite for the individual. And for information on how to apply for reimbursement, contact Jackie Tripodi at 929-202-1115, or you can email Jackie at jtripodi@nysidinc.org. NYSID also provides other services, evaluations for non-Medicaid individuals. We provide crisis management services. We also have tickets for outings. We provide that, and for transportation services. So all that information I put in the chat, Brian. Thank you. And I look forward to seeing everybody at the fair next month.
Yes. And just for clarity, Doris, when you say for the reimbursement for the camp, it has to be paid already. You're not paying it first, correct?
Correct. And then,
So I know that's often a question that comes up.
Yeah, they have to pay it first, and then we get that and we reimburse them, right?
All right. Thank you. All right. Next up, Erica.
Excuse me. Good morning, everyone. I am here to let everyone know that everyone, New York currently has quite a few openings in our Brooklyn programs, in our program in Sunset Park / Industry City, as well as our location on East 98th Street in Brownsville. I did put it in the announcements before, but I'm going to add it again along with my email and my cell phone number. So if you currently have individuals, family, friends, whomever are seeking services for site-based, please give them my email, give them my phone number, or give a call on their behalf, and we can set up a tour as soon as possible. Thank you, and everyone stay cool today.
Thank you, Erica. Any other announcements or comments? I don't see any other hands. Oh, Carlin.
Hi, everyone. I am a parent who just because I know the difficulty with keeping up with information, I developed a WhatsApp channel where I collect like the events and just information for the neurodiversity community. And so I put it in the chat just in case anyone is interested. Thank you so much.
Great. Thank you, Carlin. All right. If there's no other announcements, this meeting has been recorded. It will be posted on our website, usually within 48 hours with the chat. Hopefully everyone registered for our fair next month, and we'll see you there. Again, we should have about 70 agencies. There'll be some light refreshments. We'll have a photo booth. Great day to come out and get a lot of information from a lot of Brooklyn providers. So we can end the meeting. Thank you, everyone. Thank you to our presenters. Thank you for everyone who came on and did updates from IAC and OPWDD. Thank you for my co-chairs. We are planning to have our meeting on the Monday after our event. So our next month's meeting is Monday, the 22nd. And enjoy the weather until then. Have a great week, everyone.
Thank you. Same to you, Brian.
Thank you, guys. Have a good night.
Thank you.
Bye.
Good morning.